Bismillahirrahmanirrahim. Today lecture is about thyroid hormone synthesis. Physiological anatomy of the thyroid gland. Thyroid gland is a butterfly-shaped organ and is situated at the front of the neck in lower part of the throat. Consists of two connected lobes on either side of the trachea. See, trachea it contains two lobes located on both sides of the trachea, right and left. The lower end of the lobe is connected by thyroid isthmus, which is thin band of connective tissue. This is thyroid isthmus, which is a thin band of tissue or strip. Thyroid follicle. The gland is made of follicles, which in turn are made of follicular cells that take up iodine and produce thyroid hormone, which is stored in the follicle inside the thyroid. The thyroid is also made of another type of cell called parafollicular cell or C cells. These cells form a hormone called calcitonin, which help with calcium regulation. Follicular cells. The thyroid epithelium is morphologically and functionally polarized, with an apical surface facing the follicular lumen containing colloid and a basolateral surface facing the interstitium. This is a thyroid follicle. It is polarized. Basolateral surface, it contains positive charge. On the apical or lumen surface, it contains negative charge, and it also has lateral surfaces. The follicular cell form a very tight molecular transepithelial resistance 6000 ohm centimeter per square and establish transepithelial potential difference apical medium negative of about 20 millivolt. Here at this apical portion it has 20 millivolt of negative charge. Thyroid has polarity with the basal and in contact with the capillary bed surrounding the follicle. Here this is polarity, it is contain positive charge between the vessel, interstitial space and the surface of the thyroid cell. The sodium iodide symphoter is located in the basal membrane of the cell, and thyroid peroxidase TPO, thyroid peroxidase, is in the apical membrane. Symphoters are transport channel protein that simultaneously transport two molecules across a membrane in the same direction. In the basolateral surface of the thyroid cell, we have a pump which is responsible for the transport of sodium and iodides, and it is called symphoter. And symphoter is channel protein which transport two different signs in the same direction. Here sodium and iodine. They both are transport from the interstitial space into the interior of the thyroid cell. So this is a symphoter channel, and it is located on the basolateral membrane of the thyroid. The thyroid epithelial cell, thyroid, each epithelial cell of the thyroid follicle or thyroid is specialized to carry out all the steps required for synthesis and secretion of thyroxine, which is called T4, and triiodothyronine called T3. These are thyroid hormone, and these cells are responsible for the all-step synthesis of these two hormones. Rough endoplasmic reticulum and Golgi apparatus in the thyrocytes. Much of the interior space of basal and perinuclear portion of the thyroid is occupied by rough endoplasmic reticulum. A well-developed Golgi apparatus is located apical to the nucleus, as are the associated exocytotic vesicle for the secretion of thyroglobulin into the lumen of the follicle. In addition, the cell contains endoplasmic vesicle contain thyroglobulin and lysosomal structure that are responsible for the breakdown of thyroglobulin. The apical surface of the thyrocyte is arranged as microvilli and some pseudopodia. Here we have two structures. One is a vesicle which contains thyroglobulin, and the other is lysosomal structure which contains lysosine enzyme. And in the apical portion of the thyrocyte there are microvilli and pseudopods. These are the pseudopods. These pseudopods have a specific function which we will discuss in the upcoming slide. Synthesis of thyroid hormone. About 93% of the metabolically active hormones secreted by the thyroid gland is thyroxine, which is called T4, and 7% is triiodothyronine, which is called T3. However, almost all the thyroxine is eventually converted to triiodothyronine in the tissue, so that both are functionally important. The function of these two hormones are quantitatively the same, but they differ in rapidity and intensity of action. Triiodothyronine T3 is about 4 times as potent as thyroxine T4, but is present in the blood in much smaller quantity and persists for a much shorter time than does thyroxine. Iodine is required for formation of thyroxine. To form normal quantity of thyroxine, about 50 mg of ingested iodine in the form of iodides are required each year, or about 1 mg per week. To prevent iodine deficiency, common table salt is iodized with about 1 part iodine to every 1 million part of sodium chloride. Fat of ingested iodides. Iodides ingested orally are absorbed from the gastrointestinal tract into the blood in about the same manner as chloride. Normally, most of iodides are rapidly excreted by the kidney. 1/5 are selectively removed from the circulatory blood by the cell of thyroid gland. That is, about 20% is removed by the thyroid gland from the blood and used for synthesis of thyroid hormone. Iodide form and iodide tapering. The first stage in formation of thyroid hormone is transport of iodide by the blood into the thyroid gland cells, glandular cell and follicles against chemical and electrical gradient. Iodide is present in the blood. In first step, this is released into the interstitial space, and from the interstitial space, iodides are then transported, taken by the iodide pump, and it is transported to the lumen. The basal membrane of the thyroid cell has a specific ability to pump the iodide actively to interior of the cell. This is called iodide tapering. This transport is called iodide tapering. Iodide is transported into the lumen of the follicle by a sodium independent iodide chloride transporter named pendrine. Here at the apical side of the thyroid cell, another transporter protein is present which is called pendrine and transport iodide into the lumen. In a normal gland, the iodide pump concentrates the iodine to about 30 times its concentration in the blood. When the thyroid gland becomes maximally active, this concentration ratio can rise to as high as 250 times. Oxidation of the iodine. The first essential step in formation of thyroid hormone is conversion of the iodide into an iodized form of iodine. This is then capable of combining directly with the amino acid tyrosine. This oxidation of iodine is promoted by the enzyme peroxidase in the apical region of the thyroid cell, an enzyme is present which is called peroxidase. So the first action of this peroxidase is to oxidize. Oxidization of iodine is promoted by this enzyme peroxidase. This iodide is changed into iodine. The peroxidase is either located in the apical membrane of the cell or attached to it, thus providing the oxidized iodine at exactly the point in the cell where the thyroglobulin molecule issues from the Golgi apparatus. Thyroglobulin. The thyroid cell are typically protein secreting glandular cell. Endoplasmic reticulum and Golgi apparatus synthesize and secrete into the follicle a large glycoprotein molecule called thyroglobulin, combined with iodine to form the thyroid hormone. This thyroglobulin combined with the iodine and form thyroglobulin. The successive stages of iodination of tyrosine and final formation of the two important thyroid hormone, thyroxine and triiodothyronine. Tyrosine, remember that it is a like a protein, or you can also call tyrosine. Tyrosine is first iodized to monoiodotyrosine and then to diiodotyrosine. Then during the next few minutes, hours, and even days, more and more of the iodotyrosine residues become coupled with one another. The major hormonal product coupling reaction is the molecule thyroxine that remain part of the thyroglobulin molecule, or one molecule of monoiodotyrosine coupled with one molecule of diiodotyrosine to form triiodotyrosine, which represent about 1/15 of the final hormone. Thus, thyroid hormone from within the thyroglobulin molecule. This is the thyroxine and triiodothyronine hormone formed from the tyrosine amino acid remain part of the thyroglobulin molecule during synthesis of the thyroid hormone and even after a stored hormone in the follicular colloid. Iodination of tyrosine and formation of the thyroid hormone. Organification of thyroglobulin. The binding of iodine with the thyroglobulin molecule is called organification of the thyroglobulin. Oxidized iodine, even in the molecular form, will bind directly but very slowly with the amino acid tyrosine. In the thyroid cell, however, the oxidized iodine is associated with an iodinized enzyme that causes the process to occur within seconds or minutes. Therefore, almost as rapidly as thyroglobulin molecule is released from the Golgi apparatus or as it is secreted through the apical cell membrane into the follicle, iodine bind with the tyrosine thyroglobulin molecule. Peroxidase perform three functions. The first function is transport the iodide into the lumen cell. The second function is convert iodide into iodine. The third function is incorporate this iodine into the tyrosine. And the fourth function is it couple the incorporated iodine molecule with each other. So when one molecule of iodine is combined with tyrosine, it is called monoiodothyronine. When two molecules are combined with tyrosine, it is called diiodothyronine. And when three iodines are combined with tyrosine, it is called triiodothyronine. the peroxidase perform another function. Combine the monoiodotyrosine. It combines the monoiodotyrosine with diiodotyrosine, and in this way make a couple or join the monoiodotyrosine with diiodotyrosine, and in this way generate formation of triiodotyrosine is occur. When diiodotyrosine combine with diiodotyrosine, it leads to T4 formation or thyroxine formation or tetraiodotyrosine. And if one monoiodotyrosine is combined with triiodotyrosine, it also makes tyrosine. So this is the another function of peroxidase, which cause binding of the iodized tyrosine molecule with each other. Release of thyroxine and triiodothyronine from the thyroid gland. Thyroglobulin itself is not released into the circulating blood. Thyroxine and triiodothyronine are first cleaved from the thyroglobulin molecule, and then these pre-hormone are released. This process occurs as follows. The apical surface of thyroid cell sends out pseudopod extension that close around small portion of the colloid to form pinocytic vesicle that enter the apex of the thyroid cell. This is thyroglobulin. So here the apical end extend pseudopod into the lumen and capture a small amount of the thyroglobulin and internalize back this into the small portion of thyroglobulin into the cell, and this is called pinocyte. Then lysosome in the cell cytoplasm immediately fuse with these vesicle to form digestive vesicle containing digestive enzyme from the lysosome mixed with the colloid. This thyrocyte also contains another vesicle which is called lysosome vesicle, which contains lysosome enzyme, and this vesicle combined with the pinocyte, and in this way this vesicle add its lysosome enzyme into the pinocyte which contain thyroglobulin. And due to the digestive action of this thyroglobulin, this lysosome, the thyroglobulin is broken down into monoiodotyrosine, diiodotyrosine, triiodotyrosine, and tetraiodotyrosine. Transport of thyroxine and triiodothyronine to tissue. On entering the blood, over 90% of the thyroxine and triiodothyronine combine immediately with several of plasma protein, all of which are synthesized by the liver. Thyroxine and triiodothyronine are released slowly to tissue cells because of high affinity of plasma binding protein or thyroid hormone. On entering the tissue cell, both thyroxine and triiodothyronine again bind with intracellular protein. The thyroxine binds more strongly than the triiodothyronine. Therefore, they are again stored in the target cell themselves, and they are used slowly over a period of years. Monoiodotyrosine and diiodotyrosine are cleaved from the thyroglobulin, and they are not released into the circulatory system, but they are reused by the thyroid cell. They are transported back into the lumen and again utilized for the synthesis of thyroxine and triiodothyronine or thyroid hormone. So summary is active transport of iodine into the thyroid gland follicular cells, oxidation of iodide, iodinization of thyrocell residues with the protein thyroglobulin transfer and coupling of iodothyrosine within the thyroglobulin to form T4 and T3. Store of thyroglobulin as the colloid in the lumen of the thyroid follicle. Endocytosis of the colloid back into the thyroid epithelial cell. Proteolysis of thyroglobulin with concomitant release of T4 and T3 as well as the iodothyrosine and iodothyronins. Secretion of T4 and T3 into the blood and deiodinization of iodotyrosine within the thyroid follicle cell for reutilization by the liberated iodine. So thank you. Please don't forget subscription of the channel and your valuable comments for the improvement of the channel. Thank you. See you in the next lecture.